Thank you for joining the Spina Bifida Association's New Voices for Spina Bifida information session. Insurance coverage for incontinence supplies, what families need to know, presented by Mica Phillips of Aeroflow Urology. This session will include suggestions for families with spina bifida about access to the incontinence supplies they need through Medicaid and insurance benefits. Mica will discuss the confusing world of insurance and share practical tips to ensure access to the right products without too much paperwork. My name is Judy Thibodeau, and I'm a member of SBA staff. For this session, I'm joined by my colleague, Juanita Panliner, SBA's National Resource Manager. Now I'm pleased to introduce Mica Phillips.
I'm super honored that you all have given me this time to speak to you all about a subject that's actually really near and dear to my heart, even though it can be sometimes really confusing and seem kind of impenetrable. My name is Mica Phillips. I'm a vice president at Aeroflow Urology, a division of Aeroflow Healthcare. I've been with this company and working in healthcare for 11 years now, 10 of those 11 of which I've spent working exclusively and kind of helping facilitate a business that gets incontinence supplies, catheters, and other bowel and bladder products into patients' homes via home care by using their insurance benefits. I'm going to go through a few different sections as we go through this. I'm going to spend a very brief amount of time just talking about who Aeroflow Urology is and what we are proud of as a company. I'm not so much here to promote Aeroflow or why we're the best or anything like that, as I am just to kind of educate on the perspective of what I feel like is a quality provider of healthcare. And I'm hoping to spend the most time on sections 3 and 4 here, which is going to be some, imparting some knowledge about insurance, about documentation, working with physicians, overcoming issues with insurance, and then, of course, trying to reserve a good amount of time for Q&A period at the end. So I will get started, and please, I welcome your questions. So as I said, Aeroflow Urology, we're a subsidiary of Aeroflow Health. We are headquartered in Asheville, North Carolina. We've been in medical supplies and home care for over 20 years at this point. When I came to the company in 2014, we were 250 employees, and we just passed 1,100 employees. I was telling Judy and Juanita earlier that just in the time that I've been here, we've gone from 2 employees in our continence care division to well over 200. And so I'm incredibly proud that so very many patients and families have trusted us to, care for such a delicate and specific need. We put some points here about what we do, but also what I think is just reflective of generally quality providers. Working with your doctor, I'm sure everybody on this call knows the paperwork related to getting medical supplies through insurance is inherently not set up to be easy. I will talk more about that in detail in kind of the third section. One of the things I'm very proudest of is that what we say is we meet patients where they want to be met. We communicate through text, through email, through phone call. Everybody's really busy. You don't always have time to pick up the phone or to answer a phone call. I think it's incredibly important to have a variety of different ways to both reach patients and to be reached by patients. Additionally, as I said before, we have over 200 employees that work in continence care. Every employee that works in direct patient care attends a multiple-hour seminar specifically on continence management. We hire a lot of folks that, like myself, when I started here, do not necessarily have a medical background, but we make sure to always give really specific training that is centered on both the continence needs of children as well as adults. I think one of the most critical things that medical suppliers can do is to have their customer care people not act just as logistics and customer care people, but as actually people who can help with people navigating what can be new and very difficult medical conditions. And of course, one of the things that I'm proudest of is that we consider ourselves a leading authority in educational content related to continence care. I'd encourage everybody to visit our website, aeroflowurology.com. We have hundreds of blogs that we've written on topics ranging from specific medical conditions to proper fitment of a pull-on, how to know if you need a bladder control pad, a brief, or a protective underwear. I very much encourage everybody to go check those resources out. We have an incredible marketing team that really tries to solicit feedback from our patients and say, wow, this is a question we're seeing a lot. We need to put a resource guide out there proactively to make sure there are materials out there to help people with these questions. I was saying earlier, I've been working directly and indirectly with the Spina Bifida Association, for about 10 years now. We work with Duke Urology, Cincinnati Children's Hospital, a number of the leading pediatric facilities in the United States. And of course, because of that, we have had the opportunity to care for dozens of, people with spina bifida at various stages of the journey, either, having just started receiving specialized care, as well as, patients that have been with a different medical supplier for a really long time, and their physician trusts to say, let me refer you over to Aeroflow Urology and take care of them. And so what I really appreciate is that I know, and we'll talk about this later, there are some very specific product needs in the spina bifida segment, whether it's bowel irrigation or needing multiple different kinds of continence therapies for different kinds of, time of day or stage. And, I've been really, really proud that we've been able to take a complex medical condition and we've been able to be a trusted resource there. Wanted to provide a brief overview just in general of when insurance covers continence care supplies, what are the things that might be covered. A lot of Medicaid programs do provide for coverage of pediatric incontinence supplies, diapers, briefs, and of course, in this case of some states, wipes. Similarly, for adults that are struggling with continence issues, Medicaid programs have a coverage provision in most cases to provide adult incontinence absorbent products. What we don't have here is also bladder control pads, which are of course going to be similar to like a poise pad, an insert that's placed in the underwear for mild to moderate incontinence, which is another thing that we deal with, especially with folks that are just now starting to experience the symptoms of incontinence with stress incontinence or urge incontinence. And then, of course, there are catheters, which relative to management of spina bifida, everyone is familiar with. There are the indwelling Foley catheters that are placed by a healthcare professional. There are external condom catheters, and of course, intermittent catheters, which would include like that hydrophilic Coloplast catheter you see in the picture there. And then some insurances also provide for coverage of disposable wipes, barrier creams to both preemptively and reactively manage dermatitis, contact dermatitis, and other skin issues that can result from incontinence, as well as gloves for sterile changing, and then underpads for kind of the last line of defense for a bed or chair to make sure there's no leakage or anything like that. The reason I keep saying as it relates to the absorbent products, the diapers and so forth, is that typically it is only Medicaid programs that do provide for coverage of those. I'll touch on that a little bit more when we get to kind of the insurance section. So who qualifies for supplies? So I said before, with the incontinence products, typically it's only going to be Medicaid that does cover those products. One of the things I always like to point out, you do not have to have Medicaid as your primary insurance to cover to qualify for these supplies. We have many patients who have a Blue Cross Blue Shield, Medicare, United Healthcare, some insurance like that as their primary insurance, and they're given supplemental Medicaid as a second insurance. In many cases, having that secondary insurance will actually qualify you to get incontinence products through insurance. That's one of the biggest topics that we educate patients on, and where people are pleasantly surprised, and so that is a really important thing to know. There are a lot of folks who think, oh, well, Medicare doesn't cover this product, so I can't get it through insurance. It pays specific attention to your specific insurance, and if you have a Medicaid insurance, you may qualify for more than just that which Medicare covers. It's always required to have documentation of why a person is experiencing incontinence issues. There are a whole host of reasons. Obviously, incontinence is a symptom, and it's typically associated with hundreds of different underlying medical conditions. Insurance does require kind of documentation of that from your doctor to make sure it's a reasonable request. In the case of children, there is an age kind of floor to receive diapers and incontinence products through Medicaid. It's typically after kind of post the normal potty training ages. In most states, that's 3 or older. In some states like Illinois, that'll be 4 and older. And in some states like Kansas and I believe California, that could be even 5 and older. And so if, for example, on our website, we have a great resource where we have kind of a blog resource for each state. And that blog for that specific state talks about things like, for instance, the minimum age required to be able to access supplies through insurance for a child. Obviously, you have to have active Medicaid. And then, as I said here, it requires always a prescription from your doctor that says, I am this patient's doctor. Yes, they suffer from incontinence. Potentially, here's the reason why. And I consider this reasonable and necessary. They provide that prescription to a supplier like Aeroflow. And then we provide products shipped directly to your home and also contact you monthly ongoing to help keep your supplies refilled. So I touched on Medicaid, Medicare, and so forth, kind of a little bit. I think this will not be new information to everybody, but I never like to take for granted that everybody understands the main categories of insurance in the United States. Just the fact that Medicaid and Medicare have somewhat different or somewhat similar names creates a lot of confusion. We have patients that contact us all the time and they say, I have Medicaid, and we run their insurance and we say, what you actually have is Medicare, and vice versa. And so I'm going to talk about the main types of insurance, and then I'm going to get into some more specifics around working with those insurances. I've talked a lot about Medicaid. For those that don't know, Medicaid is it's a federally guaranteed program, but it's administered at the state level. North Carolina has its own Medicaid program, Tennessee does, and so forth. They receive a blend of funding from both the state as well as from the federal government to provide services. It is a partnership between the federal government. It falls under the umbrella of the Centers for Medicare and Medicaid Services, which does administer Medicare at a federal level. But as I said before, states have a lot of license in terms of how they run their specific Medicaid program. So for instance, as I was saying to Judy and Juanita before everybody got on here, what that can lead to, and I would suspect that probably some on this call have experienced that, is that different insurances cover very differing quantities of supplies. So for instance, when it comes to disposable protective underwear, South Carolina Medicaid will cover 96 of those at maximum per month, whereas right over the border in North Carolina, a person with incontinence can receive up to 200 per month. And so a lot of what we do as Aeroflow is we look at the benefit for specifically incontinence, because it's a subject that we're very authoritative and really want to provide the best care for patients. We'll approach state Medicaid programs and say, hey, we appreciate you have coverage for this, but there's some things about your policy that we feel like don't meet all the needs of all patients. Is this something that you would actually be amenable to discussing or possibly changing? And we kind of tell that human story of who are the people that need these products and why is it such a critical benefit to have a structure that is able to provide for the needs of every patient that could possibly need these products. And again, that's one of the things that I'm proudest of, is playing a role in that advocacy to insurance companies. As a supplier, we can talk about it differently than a patient can or a patient's physician can. It really, in a lot of cases, takes all three of those joining forces to foster change. But I'm really proud that we have, as a company, had some success in that space. A lot of you have probably heard of managed care. 20 years ago, North Carolina Medicaid was just North Carolina Medicaid. There was one Medicaid program for the state. Today, there's managed care, which means that there are actually 9 different Medicaid plans just in North Carolina. There's Blue Cross Blue Shield Medicaid of North Carolina. There's United Healthcare Medicaid of North Carolina. There's Aetna Better Health Medicaid of North Carolina. So what that is that the state and the federal government have made the decision to allow private companies to bid out the ability to be providers for Medicaid. And the reason they do that is because a lot of times these private companies say, hey, we can come in with these new benefits, new services. We can provide actually a better standard of care than the state-run program. And so many states will take on managed care as a way to kind of have multiple options available for patients. What this can create unintentionally is some confusion, because then you'll end up with, well, North Carolina Medicaid is no longer North Carolina Medicaid. Maybe United Healthcare of North Carolina covers different supplies than Blue Cross Blue Shield does, or maybe they have different documentation requirements from your physician. So there are positives to managed care, and there are some kind of unintentional negatives to it. It can definitely create confusion for people. But really, really good suppliers will try to kind of talk you through that, look at your insurance, and give you kind of a really kind of layman's term assessment of what your insurance is and what benefits are available to you through that. I also have, over here on the left, the right of the screen, I kind of said before, if for example, you were trying to get incontinence products through Medicaid for a child, often they have to be over the age of 3 or 4, depending on the state. Many Medicaid programs have a program that a lot of people don't know about, Early and Periodic Screening, Diagnostic Testing, and Treatment Program, EPSDT. That is a special exception program that many states have, where if, for example, you had a child with a serious medical condition, for example, like spina bifida, it is possible to apply for an exception to the state to, for example, receive more incontinence supplies than would normally be covered, or to receive those benefits at an age younger than 3. Obviously, like I said, with everything Medicaid, the acceptance of that, the requirements, how the chance of success of applying can vary really widely based on state. But I always like to point out that if you have received an answer that you're unhappy with in terms of an age requirement or quantity of supply you can receive, definitely talk to your health plan about if they offer any sort of exception or overage program for EPSDT. So one of the main things that we really try to educate our particular patients on is kind of the role that you have in keeping your insurance active and understanding changes in your insurance. Almost all Medicaid programs require annual what's called re-enrollment. And that means that basically the state or the Medicaid program you work with will require you to submit new paperwork that proves things like, for example, you still reside in the state you're receiving benefits from, that you still meet the income requirements of Medicaid. If you are on Medicaid for a disability reason, that disability is still accurate of a picture of your health and things like that. So where I see a lot of our patients, unfortunately, it's a very simple thing. You'll move. You won't necessarily notify Medicaid you moved. Medicaid will send you that paperwork, that re-enrollment packet. It goes to your old address. You only find out that happened once they haven't received your paperwork and your insurance lapses, at which point you effectively have to, provide that paperwork and reapply. And there can be a several week dead period where your insurance is not active and you may not be able to receive supplies through insurance or see your doctor or things like that. I don't know if anyone on the call has personally dealt with that, but we see hundreds of patients a month that have that happen. And so what we always say is, make sure you've got your most up-to-date phone number with your Medicaid program. Some Medicaid programs communicate via text. Make sure that if you have a cell phone capable of text, make sure that's the phone number that's on file with your health insurance. Make sure you have an email address on file if they'll take one, because often they'll send out digital copies of that paperwork for re-enrollment in addition to sending it out through the mail. And then, of course, as I said, make sure that you're proactive in keeping your address updated with your state's Medicaid program. One of the questions, and I think it's probably because folks have actually experienced this firsthand, I've talked about the age floor, not being able to receive incontinence products typically until age 3 or 4, depending on state. Some states, unfortunately, do not provide for coverage of incontinence products for adults. Routinely, a few of these that I'm aware of would be, for example, Alabama and Missouri. They have provisions for coverage of incontinence products up until the age of 18 or 21. But unfortunately, they have written their guidelines such that once in those states you reach 18 or 21, there's not a defined benefit for incontinence supplies through insurance anymore. Both states do have an exception program to apply for. In my personal experience, it's very difficult to be granted that exception. I will tell you that for Aeroflow's part, we are actually engaged with both of those state Medicaid programs, telling the story of why we think that it's really critical to change their policy so there's routine coverage of incontinence supplies in those states. And we are at least in the process of having that conversation. Change with insurance companies and Medicaid programs doesn't typically come quickly. But that just, that is something that we are passionate about, is we want one minimum standard of care, at least for all Medicaid programs and insurances across the United States, so that everybody can be assured of at least a certain consistent level of care, even if some insurance companies or Medicaid programs choose to offer even more than that. Again, a topic I'm extremely passionate about because insurance is inherently confusing. Trying to explain to the parent of an 18-year-old that their child turns 18 and they don't have a provision to get their supplies through insurance anymore is one of the hardest conversations that our customer care team has to have. And so I feel a great deal of responsibility and passion to try to tell the story to health insurance companies about, why they should make changes and things like that. Who's eligible for Medicaid? Typically, there are a combination of reasons that someone would have Medicaid. There are, of course, often income requirements to be at or below the federal poverty line. Often there are certain programs that are intended to be secondary insurance for people 65 and older who would typically have Medicare. People living in institutional settings like IDD homes, group homes, sometimes assisted living facilities. Many states grant automatic Medicaid to children in the foster care or guardianship care system, which again, we work really closely with several different foster agencies in North Carolina, South Carolina, and Florida as a real resource. And that's another thing that I'm very proud of, because obviously children in foster care and also foster families are dealing with a lot of different logistics. So just the ability to be able to say, here's one thing, one critical need that can be taken care of through a Medicaid benefit and shipped directly to your home. Again, very proud to be able to be a resource in that space. And then, of course, having a special need or a disability is often one of the reasons that a person would be granted Medicaid, in addition to kind of the other things above. We've got a link here that kind of gives the official Medicaid.gov website about some resources where the federal government's actually put that together, about some resources about how to get Medicaid. There is actually a wealth of information about that on Medicaid.gov, and so I encourage everybody to check, because as much as I know, I learn new things from the resources on that site all the time. So it's a fantastic resource. I also like to touch on Medicare. Medicare is, of course, the program that is granted to everybody of retirement age, 63 or 65 plus, as a federal insurance benefit. Typically, Medicare does not cover incontinence supplies. It is one of the things that, again, we are the most passionate about trying to tell the story of why we think that should change. But at current, Medicare as a program has made the decision not to cover diapers and things like that through their program. They do cover for ostomy products and for all types of catheters through Medicare. And so Aeroflow does service many patients with Medicare for the catheter and ostomy products, even though we're unable to provide Medicaid or Medicare products incontinence. I will go back and say many people have both Medicare and secondary or supplemental Medicaid. And if that is you or someone you know's insurance situation, there may be a capacity for, even though they are Medicare, to receive incontinence supplies through their secondary or supplemental insurance. And then, of course, there's private insurance, or what's sometimes called commercial insurance. And these will be names that you're familiar with. You've probably seen commercials for these companies. Aetna, Humana, United Healthcare, Blue Cross Blue Shield are four of the biggest, to name a few, but there are many, many others. I'll go back to managed care with Medicaid, what I talked about before, what can be confusing. Aetna does not just have private insurance. They also have Aetna Medicare, and they also have Aetna Better Health, which is their Medicaid program. United Healthcare has United Healthcare Medicare, United Healthcare Choice Plus, which is commercial, and then they have United Healthcare Community Plan, which is their Medicaid line of business. And then Blue Cross Blue Shield has Healthy Blue, which is their Medicaid line of business. So these companies, they engage with all segments of the population, not just, working and commercial and workplace insurance adults, but also with children, Medicaid program and Medicare program. So that is another thing that can create confusion. Medicare and Medicaid are similar terms. Wait, is Aetna my Medicare? Is it my Medicaid? Is Humana? Is it my Medicare? It's my Medicaid. Again, one of the things that we really try to do, and what a lot of other quality, medical providers will do, is we will have you submit your insurance information, and we will help explain to you what your specific insurance, or whoever you are caregiving for or responsible for, what that specific configuration of insurance kind of entitles you to. As I said before, we have some tips here on how to receive your supplies quickly. Every insurance plan is different, but the biggest advice I give to people either starting or trying to continue the process of getting supplies through insurance is to really be engaged with you or your loved one's doctor. Be really specific about when you're having, for example, a face-to-face visit, discussing the incontinence conditions, and making sure that, for example, when your medical assistant or your doctor is transcribing your visit, that you actually get a discussion about incontinence written down. If that sounds funny, it's because many insurance plans will actually say to a supplier like Aeroflow, if you want to provide incontinence supplies through insurance for this patient, we actually need to see the face-to-face notes from their doctor that proves that their doctor is aware of this condition and has recently discussed this condition, in order for them to be able to receive these supplies through insurance. And so I never like to take for granted that even if a physician might be aware that someone's suffering from incontinence, that it's actually in their medical record in that specific way. And so being proactive about saying, hey, in case we need to submit this to get any kind of supplies, can we be really specific about talking about the specific conditions that I or my loved one am dealing with? The other thing, as I said before, if you have a Medicaid or private insurance that does renew annually, set a reminder on your calendar for re-enrollment. Often insurances turn over at January 1st of the year, but there are many insurances that have November, October, August. Often it'll have a planned start and end date on your insurance card. And typically that will indicate when your next renewal is coming up. I tell people put it on your calendar, set a reminder in your phone to kind of check around that time, be very proactive and just making sure that nothing is required of you to keep your insurance active. I also encourage patients, when you're at your physician, request copies of your medical records and things like that. One of the things we unfortunately deal with is making multiple fax requests, and probably folks on here have had this complaint. Oh, we faxed the doctor 3 times. They haven't sent us anything back. And the doctor says, no, I faxed them 3 times and they're not receiving it. Fax machines are inherently unreliable. And unfortunately, so much of the medical industry does still run on faxes and things like that, believe it or not. And so I always tell patients, try to get additional copies of your documentation, because if for some reason there's a slow response on the part of a doctor or something that we're not able to obtain, you're in a position to be able to email or mail that into your supplier as an additional, line of defense of making sure that we receive what we need, because we as a supplier, of course, want to get medical products that are life critical into your hands as quickly as possible. But we, of course, have to jump through all the hoops related to documentation and so forth. And as I said before, keep an eye on your mail and your email about any changes or upcoming things to know about your insurance. So, common questions that we receive about insurance. And I think this first one's really sad. I'm sure a lot of folks on here have had some kind of a denial from insurance. If I didn't qualify before, if I was told no before, I never will. Insurance rules change. Or if your insurance changed, let's say you had Blue Cross Blue Shield last year and you were told no or something wasn't covered, and this year you've got Aetna. Honestly, you're open to a whole different set of benefits and rules. So never assume that because you've gotten an answer in the past that that's the answer with that insurance forevermore, or especially if your insurance has changed. Paperwork is too complicated. I touched on this before. Insurance, in its effort to prevent fraud, waste, and abuse, sets up really specific requirements of what they want to see from us, the supplier, obtain from your doctor. Really quality providers will be incredibly clear with both you and your doctor about what's required. But you as a patient, the more you involve yourself in the process and are an advocate and proactive, I see it all the time where we will fax a doctor 2 or 3 times and not get a response. But if a patient picks the phone up and says, Aeroflow says they faxed you 2 or 3 times, will you please send them that paperwork? We'll get that paperwork 5 minutes later, because doctors care so much more about you as their patient than they do about us as a supplier that they may not be as familiar with. And so I always tell patients, involve yourself in the process, particularly to your physician, because it really, really does speed things up. I'm sure that some folks on here have dealt with kind of the quality issue of the product that they're able to get through insurance. Maybe you're receiving an incontinence product and you don't, it's not absorbent enough for you. Unfortunately, like I said before, with the quantity of supplies you can receive, insurance does kind of set up to reimburse providers at all different levels. And so because of that, a product an overnight absorbency product we may be able to provide in the state of North Carolina, we may not be able to in all states because of how they administer their programs. What I always tell patients is, if you're not happy with the product you're receiving, don't assume it's the only option. Call your supplier and say, hey, here's the issue I'm having. This is too big. This is too tight. This is not absorbent enough. This is too bulky. Ask the question of what else is available. If they tell you that nothing else is available, contact an alternative provider and say, hey, I'm getting this product through random medical company over here. What if I'm a Medicaid beneficiary, could I get something more absorbent than that? We have patients call us all the time where some other providers told them there's only one thing that they can get, and we're able to provide a better solution. Not always. We are constrained by what we're able to do under the bounds of insurance as well, but we try to provide a solution for absolutely everybody that we can. So I always just tell people, ask. And also, if you're hearing that from suppliers routinely, pick up the phone and call your Medicaid program and give some feedback about you feel like you're being told that their program does not set you up to receive the products you need. Enough feedback about that sort of thing coming from patients, coming from providers like us, even coming from your physician. If you get told no something by an insurance company, have your doctor write a letter about why they do not agree with the decision that you cannot receive something or can't receive more of something through insurance. None of these things, one single phone call, one single letter is likely to make a change with an insurance company. But over time and with enough feedback, I have truly seen feedback provided to health plans result in policy changes. And so I always tell people it may not be you that it helps today, but it may be someone down the line, or it may be you in the future that the providing feedback to your insurance company when you're dissatisfied does make a difference. One of the questions we received was, I was denied coverage. How do I appeal? And we see this a lot with bowel irrigation, or I hear this a lot with bowel irrigation systems like the Peristeen product, which we are not a provider of, but I understand it's a product that has a really complex approval process and often gets denied. The biggest advice I give, again, start with incredibly specific documentation from your doctor. And a lot of times what insurance companies want to see is if you want a specific therapy, a specific catheter, a specific, thing like a bowel irrigation system, don't just have your doctor write, my child, my loved one, I need this. Have them write why they believe other therapies are not appropriate or why they will not meet the needs to treat the condition. That actually is something insurance companies often want to see, is not just you need this, but also here's why nothing else will work. Those are the sorts of things that when a DME files an appeal or tries to apply for an exception, those sorts of things can make a difference. Of course, nothing is guaranteed when insurance companies want to take a hard line and say, no, something's not covered. Unfortunately, they are the final authority in those cases, but there are things you can do, particularly being really specific with your doctor and your doctor being really specific with your insurance, that can all add up to at least a greater chance of success. And then we have here, I think my insurance will only cover a small amount of supplies. Like I've said several times now, coverage amounts do vary by plan. There are mostly, with a lot of insurances, the ability to require, and people probably heard prior authorization or PA. Many insurance companies have the ability to apply for more than the normal maximum of supplies. And so your supplier may be willing to submit a request. If, for example, you said, I need more than 200 catheters per month because I'm having to irrigate my bladder, 10 times a day, try to apply for a prior authorization. Now, with that, the same advice I gave above about if you've been denied, have your doctor be incredibly specific in documenting not only how many of something you need, but why you might need more than the normal maximum of those products. These are all things that, again, they don't guarantee success, but they can absolutely help fight the case if you've been denied or if you've been told, no, you can't have as many of that item and so forth. That is all I have for slides and everything. I wanted to make sure that I reserved a good amount of time for Q&A and for everybody to kind of ask questions if you have any. And so I will open the floor up to any questions and happy to answer them as best I can.
Thank you, Mica. That was really, really good, very informative. And yeah, and for everybody, who joined, this is your time to ask questions. But if you don't, I have some questions. Or until you do, I have some questions that I wanted to ask. So I'm going to jump around a little bit. But so, Mike, in your experience, as you're speaking to your customers about all the different options out there, do you feel like they are familiar with the fee for service or the spend down options?
That is one of those real complexities. I don't think that they are. I don't think most Medicaid programs have the spend down option. We do see them in a few states. And of course, I think one of the biggest advice I give with spend down accounts is to contact a case manager with Medicaid, because what I do know is in some cases, supplies purchased out of pocket, I believe in some cases, can count towards spend downs. You just have to provide evidence that the supplies were purchased out of pocket. So it's not a subject I'm quite as familiar with, but it is one where I would say contact case management with a Medicaid program and really ask, what options are there available in terms of meeting someone's spend down.
Okay, and so this is probably kind of basic. So how, if people haven't already, how could they get case management to help them with that? Is that just also on the website?
So I'm trying to think how to answer that in a comprehensive way. The first would be, a lot of states have what are called waiver programs that are kind of additional benefits that are available above and beyond standard Medicaid programs. And what we find with waiver programs is that they're not people are not proactively aware that those exist. And so, for example, in North Carolina, through our Medicaid program, we have what's called the CAP program, Community Alternatives Program. It's administered at the county level, and what it is it's a specialized case management group that per county, if you meet certain criteria of income requirements, disability requirements, IDD requirements, et cetera, you get assigned a dedicated case manager, and you also receive potentially coverage benefits above and beyond normal Medicaid. In Ohio, there is a program called the Children with Medical Handicaps program, which is also a waiver program. In South Carolina, I believe it's called the CLTC program. So many different state Medicaid programs have waivers and additional services beyond standard Medicaid benefits. I'd really encourage to contact Medicaid and say, look at my coverage. Here's my story. Are there any other programs and services out there that I'm not receiving that I could be aware of? And this is a subject I know a lot about, actually, because I have a sibling that's intellectually disabled, and she is on Medicaid, and she is a participant in a waiver program, and it provides other services to her that are of a lot of help to her because she is, kind of limited in what she's able to do on her own. And so they're really fantastic programs, and a lot of times people are not aware of those. So I can't speak to what they are in every state, but I know that I can name quite a few states where I am aware of what those are. And so I would always say, check on those.
Okay. And again, and so is this something that would be available to someone who is over 18 or 21, possibly?
So again, I think it'll vary by state. In North Carolina, we have CAP C, which is CAP for children, and CAP DA, which is CAP disabled adults. So North Carolina has specific programs under the same umbrella, but meant to address both populations. The program I'm aware of in Ohio is only for children. There may be a product centered on adult population in Ohio. I'm just not aware of it right offhand. That's where it goes to kind of communicating with Medicaid about what your specific needs are and having them make you aware. Because I do find that Medicaid programs are, if you can get to the right person, they're surprisingly helpful in trying to get you to the right benefits. In many cases, you have to get past kind of the basic, customer service and so forth. But a lot of folks that work in Medicaid programs, they're passionate about having these programs be used and having them, have the intended effect. And so just don't ever assume that you're receiving all the care you could be receiving.
Okay, so like a takeaway message would be to just sort of be persistent until you can find the right person to help you find out what you qualify for.
Definitely. And contact your county office. And if you're not having luck with your county office or your local office, contact the state level. Every Medicaid program is different, so it's really hard to speak in specificity because I see things so differently across all the different 40 plus states that we work with. But the common thing is that a lot of times there are benefits that people are not aware of. And also, like I said before, if you've been told no before, don't assume that's the final no, or that you wouldn't get a different answer from a different medical supplier, or that if your insurance changes, which often with Medicaid programs, for instance, a patient might have Blue Cross Blue Shield this year, they might be moved into United Healthcare next year, they might be moved into Aetna the following year. So even if you've been given a certain answer in the past, if your insurance has changed, it's possible that the coverage guidelines and what's available to you has changed as well. And people don't realize it. They think, oh, I have Medicaid, Medicaid's Medicaid. But when you have managed care in play, what you actually have is there's the complexity and the confusion it can generate, but it also creates potentially the opportunity that you don't just have one answer.
Okay. And then you also mentioned sort of the importance about getting your doctor to be very specific, not just so much about my patient needs this product, but why other things won't work. Is part of that letter or message then also to be very clear about like the consequences of not? So for example, I'm thinking about, you mentioned in some states, catheters, you might get a supply of 200. In other states, you might get like 80. And so, what are the consequences to the patients if they, to their kidneys, et cetera, et cetera. So like, what would you tell people what would you tell people to ask their doctors to do to make sure that the insurance agrees.
I think consequences or risks are a great thing to include in clinical notes and in letters of medical necessity. This patient has been denied 300 catheters previously without adequate access to catheters. The following health risks could occur. In most cases, when a medical supplier submits that documentation, some insurance companies, I have to say, use things like AI to review things. And so with that, you lose some of the ability for impact of things like that. But many, like for example, in Connecticut Medicaid program, they're really fantastic about going over every prior authorization in great detail and providing feedback. And so when you have an insurance company that provides human review of prior authorization claims, I do find that contextual things like that can make the difference. You've got a person sitting there, they've got a set of rules they have to follow, but in some cases they have some discretion because some things are a judgment call. And so the more compelling story you can tell about the need or why something else is not meeting the need, and yes, potentially the risks, I think it can only help. Like I said a couple of times, nothing guarantees success. If insurance wants to deny something, they are almost unilaterally able to deny, unfortunately. But the more context and the more compelling and the more complete and the more evident that the patient and doctor are in lockstep and supplier about what's needed, it can only increase your chance of success.
So you've raised a whole other thing now with AI. So I don't know how long this is, AI has been used to read over the letters of medical necessity, et cetera. But is there anything that you would suggest to kind of get around that or increase your chances of it actually being looked at by a human?
It's not a subject I'm deeply familiar on. And I think that if you've looked at 5 insurance companies, you get 6 different answers on that because everything is different every time. Biggest thing, if you receive an initial denial, there is almost always an appeal process. Appeals are almost, as far as I'm aware, reviewed by people. And so just because you've received an initial denial of something, if it's important and you are working with your doctor to get the documentation necessary, always contact your insurance and find out what the appeal process. Sometimes appeals can be done on the part of the supplier. Most often they have to be initiated by the patient who's trying to receive the care. You'll typically, in a lot of cases, receive a letter that says, unfortunately, your request for the following service, medication, whatever, was denied. A lot of times there will be instructions for appeal on that communication from your health plan. Follow through on that process. They absolutely can make a difference.
Okay, so even though it's tedious, frustrating, and you don't have time, persistence.
My wife and I just had a baby 6 months ago, and there were a few different things related to the kind of final hospital bill we got where we were kind of like, is this right? Like, it seems reasonable, but it's kind of confusing. So much as I know about insurance, and I've worked in it intimately for 11 years now, I still had a hard time navigating what I was reading and everything. So it is inherently complex. Persistence is pretty key.
Okay, all right, and I have a couple more questions I wanted to ask. So, and it was based on our conversation earlier before this started. You were talking about some of the efforts that Aeroflow does, that you've done to sort of speak to insurance companies and just tell them, like basically get them to change their policies as much as possible. Yeah. So is there anything though that the community, that this people living with spina bifida, families, is there anything that they can do to help you in your advocacy efforts?
Absolutely. We carry some weight as a provider, but also we get dismissed in some ways because we're a provider. They're going, oh, you just want to bill Medicaid for these supplies. You have a financial interest. Like, we need to hear from patients and doctors. Well, pick up the phone and call your insurance if you're unhappy with the denial or the care you're receiving by virtue of your Medicaid. They care about patient phone calls. They do. And what they care about as much or sometimes more than patient phone calls is letters from physicians that say, I'm Dr. Johnson and my patient, Mrs. Smith, recently tried to apply for the following product through Medicaid and her care was denied. I fundamentally disagree with this and would like this policy to be reviewed. I actually will tell you that if insurance companies routinely receive any even handful, dozens of letters from physicians, they do pay attention to those things because physicians are a really important part of their network and their ability to render care to patients. coming at it from the supplier angle, what we can do, what the patient can do as the beneficiary and the person needing the supplies, and what the physician can do if all three of those things are happening. Nothing happens overnight and nothing has a 100% chance of success, but those things working in concert, I have seen positive change happen 100%.
Oh, good. Well, thank you. That's encouraging. Thank you. And then just lastly, you've mentioned re-enrollment.
Mm-hmm.
And is that something that has always existed that has to be done every year, or is that relatively new?
It is something that's always existed. I do think, like I've said with everything, it can vary in its process by state. One thing that we saw was during COVID, COVID was designated a public health emergency. And so because of that, things like the need to re-enroll were actually put on hold for years because of the COVID public health emergency, which I think lasted from 2020 to late 2023. And so what happened was when the public health emergency was ended by the government, patients who had not had to submit paperwork for their Medicaid for 2 or 3 years suddenly in great numbers had to submit paperwork. And so whereas normally we might see a few hundred of our patients have a lapse in their coverage, we saw thousands of patients all at once get a lapse in their coverage. And so we went to work getting out all kind of email and physical mail communications to say, hey, there's a lapse in your insurance coverage. You need to pick up the phone and call your Medicaid program, watch your mail. Hopefully this is something that is not permanent and can be undone by you applying, giving the state program what they need. Some of the changes in discussion with Medicaid, for instance, is that some states would like to require people to re-enroll twice per year instead of once per year. All that does is redouble kind of what I said before. All the more critical to keep your contact information and address updated with Medicaid or with your insurance company, and all the more critical to watch your mail, watch your email, be set up for text messaging, be an advocate for your health, and be aware of what is going on with your insurance as best you can.
All right. Well, thank you. So, certainly a lot of work, but important work necessary. So,
absolutely, we're really, really passionate about the American healthcare system's inherently complex, and a lot of times, and in a lot of cases, I don't think it's intentional. It doesn't set people up for success, and it's not that it's like intentionally trying to deprive people of care. It's complex, it's fragmented. There's different motivations for physicians, than suppliers, than insurance companies, than state programs, than private companies. It's inherently difficult. If we're able to tell the human story of the current state of insurance, you are able over time to affect change in a way that moves towards something that's more sensible and easier to navigate, even if it comes one plan, one patient, one product at a time.
Mica, will you make a comment about hydrophilic catheters in case someone needs to know?
Yeah, absolutely. I think you asked before about the new codes that are forthcoming for hydrophilic catheters and the need for a new prescription. As far as I'm aware, the new codes being necessitated for hydrophilic catheters will require a new prescription. We, for example, have been working as a company for a few months to go ahead and get those prescriptions refreshed with the new code. What's going to happen, and I was saying this before we started the recording, is that those prescription requests for some doctors are going to generate, hey, I'd like to see this patient for a face-to-face follow-up. And so again, hopefully your supplier of your catheters will say, hey, Ms. Johnson, Medicaid wants us to, or your doctor wants to see you for a face-to-face visit. Realize that if you do not take the step of doing that, you may see a lapse in your supplies, and be proactive about that, especially because you can't always get into your doctor immediately. The nice thing about the hydrophilic codes is that I really believe it's a positive change on the policy of Medicaid. I think it's going to correct some of the issues where sometimes hydrophilic catheters are difficult to obtain, especially some of the newer kind of travel and pocket catheters and discrete catheters and things like that. I think the new structure is actually going to make it quite a bit easier for suppliers to be able to provide those sorts of things. So while it's going to result in some short-term new prescriptions, confusion probably, what code is it? Oh gosh, your doctor signed for the wrong code. I need another prescription. I think ultimately it's going to open up the availability of those more advanced therapies to the patients that really need them more than it has been in the past. So I'm really excited for that change. And I think it's a really good example of patients, manufacturers, doctors, a lot of different people working together to advocate for that change with Medicare. That is a process that has been going on for I think 5 of the 11 years that I've been in this industry. And so to see it actually but that shows you how slow change can take place sometimes, but to see that come to fruition it's actually pretty cool.
Right. Thank you. Any last questions from anyone? Well, Michael, we've learned a lot. This session is recorded and will be shared with all the people who registered, and it'll become part of our YouTube library. That's right, Juanita, yes?
That is correct.
So people can continue to learn from what you have shared with us tonight, even if they weren't present. So we appreciate all you've done, and we may reach out to you for more questions in the future.
It's a subject, it can seem dry, but I am oddly passionate about insurance and how to get medical supplies through insurance. I live it and breathe it, and we do as a company. And so I am more than happy to answer questions anytime and be a resource.
Dry but necessary, right?
That's right.
Right. All right. Thanks, everyone.